what is human health and what determines how healthy you are, right? So by definition, I think we think of health as the absence of disease, but there are many things that determine how healthy you are. So I'm going to try to build a pyramid for you today. At the very bottom of the pyramid, or the fundamental, are genetics and biology. Now, this includes what you're born with and how your cells and organs respond to changes, particularly as you get older. Then beyond that, you have your environment. This includes the air that you breathe, the water that you drink, products that you use, where you live and work, how much traffic pollution you're exposed to, and all of these other things. Then you also have your behaviors. This includes what you eat, how much you exercise, how much you smoke and drink alcohol, how much you sleep, and other things as well. And of course, in spite of scientific advancements that we have made over the past few decades, there are many things that we still don't fully understand about what determines human health. So I left a question mark there and said other factors. How does aging play into all of this? Aging is the number one risk factor for almost all chronic diseases. So there's an epidemic of chronic illness that's killing us too soon all over the world. And this is true for Sri Lanka as well. And many of you may have encountered family members, or maybe you yourself might be concerned about some of these diseases like heart disease, cancer, chronic lung disease, stroke, diabetes, and chronic kidney disease. What we see when you factor in aging is the fact that when people are older, this is data from the Global Burden of Disease study, when people are younger, so if you look at the graph towards the left side of the corner, you see your younger age groups, and towards the right side, you see the older age groups. So when you're young, you don't see a lot of chronic diseases in the population, which is true, right? This is not rocket science. However, as the population gets older, there will be a lot more people who have these chronic diseases. So at the end of the day, the number of people with chronic disease increases with age. So this is really why aging is so important when you think about chronic diseases.